Hi class, and welcome to the digestive system, chapter 22. I divided this into two parts. I really kind of took down a lot of the slides, so I just kind of left up what I want you guys to know. There are still a lot of slides in this section that covers a lot of the anatomy. And again, I'm going to pass over a lot of that because I hopefully you remember a little bit of it. And also if there is something of the anatomy I want you to remember, I usually highlight it. So here are the main functions of the digestive system, taking in food, breaking it down into the nutrient molecules. So really breaking it down into teeny tiny compartments, just so that those molecules are then able to be absorbed into the bloodstream, as well as ridding the body of any indigestible remains. So anything that can't be digested or useful for the body will then be usually sent out via some sort of defecation process. Some waste products go out through our urine as well, but a lot of that is the defecation. All right, so a little bit more overview of the digestive system. If organs of your digestive system either fall into your alimentary canal, the GI tract, which is the one long continuous tube. This is where digestion, absorption takes place. You should know the organs of the alimentary canal, as well as the accessory organs, your teeth, your tongue, your gallbladder, all the digestive glands that produce secretions that help break down the foodstuffs, like your salivary glands, producing saliva, the liver, and the pancreas. And for those of you who are just joining, I just started the recording just a couple minutes early. You didn't miss anything. I started it a couple minutes early just to get through this long PowerPoint. So you should know the accessory digestive organs as well. You will have the picture labeling these organs on your next test. And just a reminder that your next lecture exam will not be cumulative. It'll only be on these chapters that we cover right now, chapter 21, 22, 23, and 24, I believe. So here we have, just generally review this for your anatomy purposes. Know the organs that make up the GI tract, as well as all of your accessory organs. Then the digestive process involves 6 essential activities. We have ingestion, which is the act of eating. Propulsion is the movement of food through the alimentary canal, which starts with swallowing, continues on with peristalsis, which uses alternating waves of contraction and relaxation. And then we'll talk about segmentation, but this is just comparing peristalsis and segmentation. And you should know these digestive processes and what they mean. So what peristalsis means, what segmentation means. And what peristalsis means, basically your food is moved distally or further away from the mouth along the tract. The primary propulsive it kind of like squeezes the food down. So peristalsis will occur in the esophagus, kind of like squeezing a Go-Gurt tube. Segmentation, this is what occurs in the large intestine. This is when food is moved forward and backward, where primarily we want to just mix the food and break it down mechanically. So those are some differences between peristalsis and segmentation. Mechanical breakdown involves chewing. So basically the mechanical breakdown of the foodstuffs into smaller pieces. So this starts in the mouth when we mix food with saliva, also churning and kind of mixing food up in the stomach, as well as segmentation. This is all kind of falls underneath what we call mechanical breakdown. Segmentation then is a part of this because it mixes the food with your digestive juices. Digestion then itself is a series of catabolic steps, and we'll talk about what that means, that involves enzymes breaking down complex food molecules into chemical building blocks. Then we have absorption, is the passage of digested fragments, anything that we need to absorb from the lumen of your GI tract or the tube directly into the blood capillary system. We'll talk about what that is, or lymph. And then defecation is the elimination of anything indigestible via your anus in the form of feces. So those are all the processes. And then this is just a picture describing the 6 different processes that occur in the digestive system tract. So the histology, how we organize the digestive system, and this is a little review from anatomy as well, but there is a test question just describing these 4 basic layers or tunics. So all your digestive organs in the alimentary canal have the same 4 layers to them. And they're shown here, the mucosa, submucosa, muscularis externa, and then the serosa. And you should know those 4 layers. You should know their order of them. You know, the one closest to the lumen and the one furthest away. And basically kind of what the main purpose is of each. So the mucosa is the innermost tunic that lines the lumen, and the lumen is the tube that the food moves down, or the waste. It has different layers that perform one or all 3 of these functions: secreting mucus, absorbing, and protecting against infectious diseases. And it's made up of these 3 sublayers, which are shown here, which we don't need to get into too much detail because we'll go over some of these details when we go through specific parts of your digestive system as well. So a picture like this, you should know well. So here is your mucosa layer. This is the innermost layer that actually lines the lumen or the tube, and that is kind of highlighted there. Underneath, or kind of moving our way out exteriorly, we have the submucosa layer, then the muscularis externa, where we'll have some muscle layers, and then we'll have the serosa, which is basically just connective tissue that connects that part of the GI tract with the organs surrounding it. So here's the submucosa. It's the connective tissue directly underneath the mucosa. There's elastic tissues in it. It'll have blood and lymphatic vessels. The muscularis externa then is the muscle layer, and this will be the muscle layer that kind of is responsible for segmentation, mixing the food along, and peristalsis. So we'll have 2 kind of muscle layers, an inner circular layer and outer longitudinal layer. Again, details you don't need to know specifically, but you just should know muscularis externa is the muscular layer that helps to kind of push and propel the food along. The circular layer thickens in some areas to form what we call sphincters, and they will open and close to allow these foodstuffs and waste products to move along your GI tract. And then the serosa is the outermost layer. Again, it kind of works as connective tissue to just anchor these digestive tract organs, parts of the GI tract to the surrounding tissues in the body. So you might see a picture like this that you have to label on your lecture exam as well. Then blood supply. So your digestive system kind of has its own blood supply. So it's called splenic circulation. These will be specific arteries that branch off of the aorta to serve all of your digestive organs. And you'll have different arteries depending on where they're going. Hepatic will go to the liver, splenic will go to the spleen, gastric will go to the stomach, inferior and superior mesenteric arteries will go to your intestines. This is something I do want you to know, though. The hepatic portal circulation, or the hepatic portal system, is what will, when we absorb nutrients that are digested through our small intestine, they go into this blood system. So anything nutrient rich that we are eating and gets absorbed into our bloodstream is entering into this hepatic portal system. And if you remember what the word hepatic means, that is always connected with your liver. So the hepatic portal circulation will always take the nutrient-rich blood that's been absorbed from the nutrients in the digestive system, and it always delivers it to your liver, because your liver is kind of like your body's recycling center. Your liver will always take in nutrients, toxins, alcohol, drugs. Your liver always is the one that basically saves you on the weekend and other nights of the year. So take care of your liver and don't be nice, be kind to it. But that's what this refers to. The hepatic portal system are all the arteries and veins that take the nutrient-rich blood to your liver, where it gets processed, detoxified, and then that liver goes back on through the circulation to go back to the heart. So now we'll go into the functional anatomy. And this is where I might go pretty quickly through this because this is a lot of review from anatomy. I do highlight a couple things that I want you to know or review specifically from the anatomy section. So we start with mechanical digestion, and it starts in the mouth with these associated organs: the tongue, the salivary glands, the teeth. The mouth itself is called the oral cavity. You have lips and cheeks to help make up the boundary. So here we have the oral cavity, with the large muscular tongue. And again, the oral cavity is really important because this will start mechanical digestion, so breaking the foodstuffs down into smaller pieces, as well as chemical digestion, because saliva contains an enzyme called salivary amylase that comes from all your salivary glands that also helps with digestion. On your tongue, you have different taste buds and papillae, which we won't get to. The functions of saliva, the saliva is very important for keeping your mouth clean, dissolving food chemicals so that you can taste them. Saliva will moisten the food, compact it into what we call a bolus, and begins the breakdown of starch with the enzyme amylase. And we have various salivary glands located throughout the mouth, the parotid, submandibular, sublingual. The composition of saliva is mostly water. It's slightly acidic, but it does have this lysozyme and the salivary amylase, which either helps to protect against microorganisms or break down carbohydrates. Then we have teeth. I won't get into too much of teeth. The official word for chewing, or the process of chewing that tears and grinds food down, is called mastication. You can have primary baby teeth or permanent adult teeth. The dentition and dental formula, the molars. The one part I do want you to know is that on the crown is the part that's exposed above your gum, the gingiva. That's what you guys brush when you brush your teeth twice a day. It's covered by a substance called enamel, which is the hardest substance in the body. And the enamel is what will get kind of the most use as you're eating, because the enamel will always be, breaking apart your food, but the enamel is the hardest substance in your body, and it's covering the crown. Enamel producing cells can degenerate when the tooth erupts, so no healing. It doesn't occur if the tooth decays or cracks. So this is usually what a cavity is. If there's a crack or decay, then it has to be filled with some sort of cement. So here's your tooth structure. I'm going to kind of pass over this a little bit, but there is the anatomy of a tooth, if you remember that a little bit. And you can see the crown, again, covering by the enamel, which is the hardest substance in the body. And then we go into the next section. So we're kind of just working our way down the digestive tract. And the anatomy and physiology are just kind of tied in together here. So I'll pass over the anatomy part and focus on phys. But in the pharynx is just another word for your throat. So food will pass down into your oropharynx, the laryngopharynx. It will not go down your trachea like we learned about on Tuesday, because the epiglottis closes over your trachea so that food goes down the posterior esophagus. The esophagus itself is a flat muscular tube, and it will always be collapsed unless it's involved in food propulsion. It joins the stomach at the cardial orifice. And we have a gastroesophageal sphincter, which will open to allow food to pass from the esophagus into your stomach. And it usually takes food about 6 to 8 seconds to get down your esophagus, to get into your stomach. You have mucus cells on both sides of the sphincter to help to protect the esophagus if there's acid reflux. So sometimes this esophageal sphincter won't close all the way, and your stomach is very acidic. So that's when we get acid reflux. Acid comes into your esophagus. This can happen during, if you're overweight, even during pregnancy. It can be genetic, but it's not pleasant. The esophagus has all the 4 alimentary canal layers that we talked about. So this is a look at the esophagus and the lumen, and then the 4 layers as shown there. And you can see how the esophagus is collapsible, and it will stay collapsed unless there's food traveling through it. This talks about heartburn. It's when stomach acid gets regurgitated into your esophagus. It's the first symptom of GERD, which is gastroesophageal reflux disease. So this heartburn can turn into a disease, and it can be caused by excess food, drink, extreme obesity, sometimes only temporarily during pregnancy or even running. It also can be caused by a hiatal hernia, which is a structural abnormality where part of your stomach actually protrudes above the diaphragm. So here's a look at deglutition, which is the proper name for swallowing. And it goes through the different phases of swallowing, which I don't ask you about, but I just wanted you to see how peristalsis again moves the food through the esophagus into the stomach. This is where the gastroesophageal sphincter will open to allow that bolus of food to enter the stomach. And again, when the gastroesophageal sphincter can't close all the way, that's when we get acid reflux coming back into the esophagus. So into the stomach is like our storage tank. From here, it converts the bolus of food into a paste-like chyme, which sounds wonderful. An empty stomach has about 50 milliliters of volume, but it can expand up to 4 liters. And when empty, the stomach mucosa can form many folds called rugae, which you might have remembered from anatomy. These are the major regions of the stomach, which I'll let you review on your own and shown here. So this is basic anatomy of the stomach with a lesser and greater curvature, the different muscular layers. Again, the prime purpose of the stomach is to churn the food and mix it. Not a whole lot of, no absorption occurs in the stomach. We're still trying to break the food down a lot. Our autonomic nervous system supplies the stomach with its own blood supply as well. All right, so basically this is where we get a function of the stomach. So the stomach has smooth muscles that not only allow it to churn, mix, and move the chyme, but also to pummel it, which increases physical breakdown and kind of ramming it into the small intestine. The mucosal layer is interesting because it's dotted with what we call gastric pits, which lead into gastric glands. And gastric glands produce a specific type of gastric juice for the stomach. And this is a look at the epithelium of the stomach, and you kind of see these gastric pits, and they're lined with specific types of cells that we're going to go over. So these are the types of gland cells. You can kind of see these different colored cells lining these pits of the stomach. And these are the 4 different types of cells in the stomach. I didn't highlight this, but you should know it. There will be a question or two about the different cells of the stomach: the mucous neck cells, the parietal cells, the chief cells, and the enteroendocrine cells. And we'll go over here. The mucous neck cells will secrete a thin acidic mucus. And then we have parietal cells, which secrete hydrochloric acid. Your stomach is incredibly acidic. This acidity is around pH of 1.5 to 3.5, which is very acidic. It's at the lower end of the scale. This acidity will help to denature protein. So it'll help to break down protein. It'll activate what we call pepsin, which will be important later on. It will break down plant cell walls. So when you eat lettuce or celery or anything plant-based, this very acidic hydrochloric acid breaks that down, and it kills many bacteria as well. So these are your parietal cells secreting hydrochloric acid, which makes your stomach incredibly acidic, but has really important functions for the breakdown and protection. It also secretes intrinsic factor, which is very important. It's a glycoprotein, and it's required for absorption of a specific vitamin your body needs, vitamin B12, in the small intestine. Your chief cells are another type of cell, and what they secrete is called pepsinogen. And pepsinogen is the inactive enzyme that is activated to pepsin by HCl. So these cells are kind of working together as a team because you have parietal cells secreting HCl, which will activate pepsinogen to pepsin, but pepsin itself is secreted by the chief cells. It also secretes lipases, which digest about 15% of your lipids. Enteroendocrine cells will secrete some chemical messengers, which are some of your hormones that will be used later on. So here is a look at the gastric pits and the different cells and what they secrete. So this might be just a good thing to remember. So remember, parietal cells will be what secrete HCl and the intrinsic factor. And then chief cells secrete pepsinogen, which will be activated to pepsin. We have a mucosal barrier, which you have very harsh conditions in your stomach, and they need to be protected. So basically, this mucosal barrier just protects the stomach wall itself from the acidity of the juices. So that's all that this extra mucosal barrier does. If you have gastritis, which is inflammation of the stomach, it's anything that can get through that stomach's mucosal barrier. You could get a peptic or a gastric ulcer, which is actually a hole in your stomach wall, which can be extremely painful and dangerous. It can lead to peritonitis, which would be inflammation of the peritoneum, which is the lining of the abdominal cavity itself, or hemorrhage. Most ulcers are actually caused by a bacteria, but they can also be caused by some NSAIDs. So that's why they say to be careful with how much aspirin you take. And there was just a recent study that came out, people usually take one baby aspirin to fight off heart disease or stroke or heart attack, but now they're saying maybe you shouldn't do that because the negative effects of aspirin. So here's a look at a gastric ulcer, a hole in your stomach wall. Doesn't that look nice? But again, this occurs when that mucosal barrier or something fights through it, usually due to a bacteria, but ulcers can also be caused by stress. You might have heard that before. And here's a look at the bacteria that will kind of eat its way against the mucosal layer of the stomach wall. Here are some hormones that are involved in digestion. I don't think I asked you questions about that. Here's a look at how the stomach kind of moves and waves and churns the food around. Again, it's kind of a really intense process. It tries to ram the food up against the walls to break it down and eventually ram it into the duodenum, which is the first part of the small intestine. Here is how often your stomach empties, about 4 hours, but if you have extra fat in there, it might take 6 hours. And then this is look at other factors that increase or inhibit gastric emptying, which I won't ask you guys. Vomiting is caused by extreme stretching of the stomach, and it's usually caused by some sort of irritant, bacteria, excessive alcohol, any spicy food or certain drugs, food poisoning. Excessive vomiting can be extremely dangerous though, because it could lead to dehydration, but also an electrolyte and acid-base imbalance, alkalosis, because if you vomit all of your stomach contents, your stomach is very acidic, you'll begin to fall into the alkalosis or basic range of the body. So here's the liver, gallbladder, and pancreas. These are accessory organs that you should know. The liver, the digestive function is to produce bile, and the gallbladder stores bile. So people can live without their gallbladders because their liver will continue to produce bile. Your gallbladder just acts as a storage tank for it. Bile itself is what we call a fat emulsifier, and we'll talk about what emulsification is. The pancreas supplies most of your enzymes needed to digest the chyme when it gets into the small intestine, as well as bicarbonate to help neutralize any stomach acid that might have made its way into the small intestine as well. So here's some gross anatomy of the liver. As shown there, it has different lobes, different ligaments to attach it. Looking at the bottom side, you can see the gallbladder here. Sometimes on a cadaver, the gallbladder will actually be green because bile has a greenish color to it. It has arteries and veins that could take blood supply to it, because if you remember, the liver is where everything goes after you eat and digest everything. Anything that gets absorbed into the bloodstream goes into the liver. The common hepatic duct leaves the liver. The cystic duct connects it to the gallbladder. And then the bile duct is what's formed by when the common hepatic and cystic ducts join together. So reviewing some of that duct system nameage will be important as well. So then let's talk about bile and why bile is important. It's a yellow-green, it's an alkaline or basic solution, and it contains what we call bile salts, which are cholesterol derivatives. What they do is they function in fat emulsification and absorption of fat. And what emulsification is, I think we get to it eventually, but basically the bile itself will kind of surround each fat molecule to try to help break it up, because fat is really hard to break up in your body. So that's why we have a specific molecule called bile to help break up the fat when you eat it, and then it'll help absorb it into your bloodstream, actually into your lymphatic lymph system. Blood always gets absorbed into your lymphatic system. Bilirubin will be a pigment formed from heme. So that's what bile is composed of, all of these molecules. Some imbalances of the liver. Hepatitis is an inflammation of the liver, usually due to a viral infection. Drug toxicity if you eat the wrong kind of mushrooms. Cirrhosis is a chronic inflammation of the liver from chronic hepatitis or even alcoholism. And cirrhosis can usually lead to permanent liver damage. Liver transplants can be successful, but livers are extremely scarce. A liver, what's cool about the liver is it can regenerate it to its full size in about 6 to 12 months. after 80% removal. The gallbladder then is a thin-walled muscular sac, and all it does is it stores and concentrates bile by absorbing some of the water and ions out of bile. If you've heard of someone with gallstones, that is caused by too much cholesterol or too few bile salts, and this can obstruct the flow of bile from the gallbladder, and that can cause incredible pain. So if you know of anyone who is complaining of just a lot of pain around their abdominal region, not always, but sometimes it can be a sign of obesity or poor eating habits or exercise habits, not always. But it can just be extremely painful when these gallstones block the flow because you're actually feeling the gallbladder contracting against those sharp crystals. So that's why it makes it really painful. An obstructive jaundice can be blockage, which causes the bile salts and pigments to build up in the blood, resulting in actually jaundiced or yellow skin. So if someone starts to turn yellow or jaundice, then you definitely probably think it's a problem with their gallbladder. However, jaundice could also be caused by liver failure. Gallstone treatment is usually, you can try to dissolve the crystals, ultrasound vibrations, laser vaporization, or eventually just surgery where you will remove the gallstones or the gallbladder altogether. And that's kind of the coolest thing to see. If you ever see a gallbladder removed with gallstones and they just open it up and it's filled with like these little rocks of gallstones. And something to just keep in mind is usually to eat less fatty substances, because fatty substances will build up the cholesterol, which will lead to these gallstones. So the pancreas, again, a little bit of anatomy review. I'll let you read through that. It has, again, an endocrine and exocrine function, meaning the endocrine function produces hormones, and the exocrine function is where we have these acinar cells secreting all of the digestive enzymes. So the pancreas's main function in digestion is to secrete all the digestive enzymes that will digest our food and break it down further. And we'll talk more in the next chapter the next part of digestion, how that breakdown of food occurs. So the pancreas delivers all of its enzymes in what we call this ampulla that we'll talk about. The bile duct and the pancreatic duct actually join in a part of the wall of the duodenum to fuse in a bulb-like structure called the hepatopancreatic ampulla. And this is like just the little hole where the pancreatic duct and the bile duct will empty their secretions into the duodenum. And you can probably see that here, this hepatopancreatic ampulla. You can see here the bile duct coming down from the liver and gallbladder bringing bile, and then you see the main pancreatic duct also emptying out there. In this, again, it's called the hepatopancreatic ampulla, so you should know that name. And it's just the place or the kind of enlarged hole in the duodenum where all of these secretions will be put in. And that's the end of part 1 in the digestive system. What I'm going to do is I'm probably going to record and post part 2, which will be much shorter by tomorrow. And also look for that posting by tomorrow evening. For this weekend, you guys have just a quiz due. It's an open note, open book quiz on your digestive system. I think that's everything I wanted to share with you. Just let me look at my Canvas. I posted a most recent announcement just talking about a way you guys can earn some more extra credit by doing this SLO assessment, which hopefully you see in your dashboard, or it should open soon. And all you need to do, remember that the access code is simply number 1. It's the number of our course. And if you do that and send me a screenshot, I'll give you 2 extra points on your final lecture exam. So thanks for listening, guys. I'll answer any questions for those of you who are here, but I hope you have a great night.